Hello and thanks for tuning in. I'm Holly Shields, welcoming you to another edition of Kalkine TV's Executive Corner Expert Talks. Today we'll be shedding a light on Capsule, the company that enables the systematic use of healthcare data. And the best way to do that is to sit down with the CEO, Mr. David Chen. David, thanks for joining me.
Great to be here, Holly, and thanks for having me.
It's a pleasure to have you on the show. First and foremost, I'd love to know, what would you say are some of the big issues facing the healthcare sector at the moment?
Well, the healthcare sector is having some huge challenges, as we all know in recent years with the COVID and the huge vaccination drive. But what I will say is that there's been a lot of progress in the global healthcare system, especially when you consider where we're coming from in, say, the turn of the millennium. But that being said, no healthcare system is perfect, so there's a lot of work to be done. And one of the things that we refer to here at Capsule is what we call the 3 A's, and that's affordability, accessibility, and authenticity of healthcare and medicines across the world. So when you consider how the world can improve or how the global healthcare system can improve, it's really driving forward those 3 things. And the way you do that is through a mixture of methods. It could be both legally, or it could be through innovation and technology, which is our domain.
Right. It's interesting that we have that criteria there that do sound quite basic, and yet they are so crucial. I mean, accessibility, affordability, and the third one there, I believe, was authenticity. What does that final one mean there?
Yeah, so this one is more specific to developing markets, and one of the reasons why Capsule was founded, because what you often have in developing markets is a case where you have a lot of counterfeit medicines that could be circulating in the system, and you also have quality assurance, which can be an issue. So making sure that medicines are kept in the right conditions so that by the time that they reach patients, they're actually working, because that is a huge issue in some of the markets that we've decided to focus on.
Right, that does make perfect sense there. I think that's a very important component rather, especially for the markets that you are choosing to focus on there. So could you maybe shed some light for us on the specific solutions that you provide through your tech and your systematic market insights as well?
Yeah, so that's a very big question. I think I'll start with the second part of the question on the market insights. So when looking at the global healthcare space, there's a lot of different nuances depending on the markets in which you work in, and each one has their own nuance and complexity. So I won't pretend to have the answers for everywhere across the world, but I can make more general observations and comments. What I have noticed is that there are 2 types of issues generally that you notice in the healthcare system. The first type is a consequence of the system running itself, and usually is down to incentives. And those incentives could be commercial incentives, or how each individual company and organization works within a larger ecosystem. And then on a second level, it's also down to the actual technology and infrastructure in play. So in terms of how we view this, we think that on the first instance, on the incentive piece, usually the issues that you see are a consequence of the financial incentives. So for instance, you have, let's take for instance the US healthcare system, which many people across the world are familiar with. One of the major issues that they talk about there is the cost issues. And when you look into the fundamental incentives behind that, when you have a private sector owned healthcare institution, everyone is incentivized by corporate profits, because that is the legal obligation of everyone who's working within the system. So you have doctors, pharmaceutical companies, health insurers, etc., who are all legally incentivized to maximize return for their shareholders. And what that results in is Obviously, you have to do what's right for your shareholders, and that necessarily isn't right for the patient at the end of the day. Now, one of the ways in which that's being resolved is through the creation of a different corporate structure, which is a B Corporation, which is a unique corporate structure in which you can make a company make company things like values, impact on climate, environmental protection, and so on, as important or even more important than returns to shareholders. So then that changes the incentive structure a little bit more favorable to the end patient or to the end consumer. And I'd say the second piece is on the actual technology and the infrastructure pieces involved. Now, often these were built very long ago for legacy systems and weren't built with the internet in mind, worldwide computing in mind. So you have a large piece of work that needs to be done to upgrade how technology is used, but also upgrade the thinking about how you use technology to actually drive forward the impact that you're trying to make, or drive forward the results that you're trying to have. And then that kind of ties into the first part of the question of what Capsule actually does. So Capsule is, what we say is we are enabling the systematic use of healthcare data. So that's a very, it could almost be a confusing statement, but to take it back to a bit of context, what we realize is that you can't improve anything without having information. And without information, you can't analyze your processes, you can't improve your processes, and therefore we believe that to have the biggest impact on the healthcare sector, we need to enable people within the healthcare sector to have a view of what's actually going on. So we found a few unique problems where we thought that we can solve. The first one was through what we alluded to earlier when it came to quality assurance and the authenticity of medicines, is actually viewing what is happening in medicine supply chains. So particularly in emerging markets or even in rural locations where you don't have as much infrastructure around, it's very difficult to see what is actually happening to products as it's moving in transit. So what we've done is we've built a suite of applications as well as some IoT devices that can actually monitor the actual product as it's moving through the supply chain until it gets to the end patient, and that therefore making sure that it's kept in the right conditions and reaches the patient in the highest quality, but also we're actually building a map of where the product is going. So for instance, in some of the markets we're operating in here, you have an issue called parallel importing, where medicines which are destined for one destination can be diverted to another one, usually because you can sell them for a higher price in another market. So you have products going in unknown areas and unknown locations. So we provide that visibility and tracking there. And the second piece is more about the healthcare data itself. So one thing that we discovered is that many hospitals and clinics have actually digitized to some extent. It's just they can't actually do anything useful with all the information that they collect. So they see thousands of patients, sometimes per day or per week, and they're collecting all this data about what diseases they have, where they came in from, how long it takes to be treated, when they recover, whether they're paying out of pocket or via insurer. But all of that data is just sitting on a server doing nothing. And it doesn't help inform decisions, it doesn't help planning. And at the end of the day, the hospitals and clinics are very reactive and responding to issues as and when they come. So what we've done is we've done what we call tech enablement. So firstly, building the plumbing to allow data to flow freely between the clinics to the health ministries and as well as to the likes of Capsule. And then when you have that data flow, you can do two things. One, you can start viewing that data and doing reports. And then you can say, these are the trends that we're seeing. This is how we can improve our operations based on real data. And the second thing we can do is actually aggregate data from many different clinics together in what we call a data lake, pool it all together, and then you can have much more interesting and insightful views into that data. So you can say, countrywide, these are the trends that we're seeing, these are the things that are leading to those trends, and these are the impacts that it's having on patients. And it could also inform how you procure medicines, how you distribute medicines, and things like that. So you can go from being very reactive initially to very proactive.
Right. I mean, it sounds like your clients are essentially able to access that data and put it to work and really compare it in all the fields that need to be compared, rather, and draw conclusions from that to better their businesses.
Exactly, because one of my old bosses used to say something to me all the time, and it's a tweak of I think it's a Franklin Covey statement, but what gets measured gets improved. So he was always saying, keep clean data, monitor your data, and then you can improve things along the way. And that's really the mindset that we took into the Capsule and to the healthcare system. So we're enabling them to measure things so they can improve them.
Well, you're quite right. It sounds like it's certainly been successful as well for you so far, that line of thinking. You've won several awards, I believe, which is an incredible achievement in the time that you've been established. So congratulations on that. And I'd love to know as well what we can look forward to seeing from Capsule in the year ahead.
Yeah, so Capsule's in a very exciting phase at the moment. Not only have we been working with some large institutions, we've done actually a project in Australia, funnily enough, alongside some great partners in HR Wallingford as well as NSL Research, where we were helping a multinational pharmaceutical company manage their supply chain more efficiently by using things like satellite data to make them a lot more agile and respond to emerging weather threats like the flooding and the bushfires, which wreak havoc in Australia. And those projects will be kicking off, going live, and will be having an impact locally in Australia. And as well, in parallel, we plan to ramp up what we're doing here. So I'm based in Rwanda, in Kigali at the moment. So we're doing a lot of work with local clinics here and also in the East Africa region. So it's expansion both in Africa and also doing some delivery of work in Australia. And essentially, we're looking to grow the team and have more people join our mission in driving forward the 3As. So it's growth, it's change, it's developing new products and finding ways to address new challenges.
Very exciting stuff. I mean, it does sound like you have a massive year ahead of you there, and a very action-packed one too, with a lot of growth on your horizon, I can imagine. So we do look forward to seeing that eventual expansion, particularly of your team and of the markets you operate in. That's very exciting as well. So we'll definitely keep an eye on it. But with that said, thanks very much for joining us today, David. It's been really great to have you on Executive Corner Expert Talks.
Thank you so much, Holly. Real pleasure to be here.
Pleasure to have you on the show. Thanks for your time as well, viewers. That was David Chen, the co-founder of Capsule. And if you missed any part of that chat, you can catch the full interview on our YouTube channel at Kalkine Media, and make sure to subscribe. I'm Holly Shields, reminding you to stay apprised and invest wise of Kalkine.